What if your body started giving you signals that the end of life was near? Would you recognize them? It's a question most of us avoid, but the truth is our bodies often provide warning signs long before we even realize it. Being aware of these signals can not only give us peace of mind, but also help us prepare for the final stages with dignity and care. In today's video, we'll explore 7 critical warning signs that might indicate the end of life is approaching, and more importantly, what you can do when you recognize them. Knowing how to respond can make all the difference, offering comfort to both you and your loved ones during a challenging time. Let's dive in. Sign 1. Extreme fatigue and weakness. One of the earliest and most noticeable signs that the body is nearing the end of life is extreme fatigue and weakness. It's more than just feeling tired after a busy day or a poor night's sleep. This kind of exhaustion can last for weeks or months, often affecting the person's ability to perform even the most basic tasks. As the body starts to slow down, it may struggle to get the energy it needs to function normally, and this prolonged fatigue can signal that underlying health issues are at play. For the individual experiencing this fatigue, it can be physically overwhelming. Simple tasks like getting out of bed, dressing, or even sitting up may require tremendous effort. The body feels heavy, and the energy needed to get through the day seems just out of reach. This constant weakness can also lead to a sense of emotional frustration and helplessness, as the individual may feel they're losing their independence and dignity. For their loved ones, it can be heart-wrenching to watch a once vibrant person struggle with such basic movements and activities. The emotional toll is real, as they may feel unsure of how to help or what they can do to make their loved one feel more comfortable. The physical and emotional effects of extreme fatigue can ripple out to those around the individual. Family and friends may feel overwhelmed by the constant caregiving needed, while the person experiencing weakness might struggle with feelings of depression or isolation. The decline in energy also means that socializing or engaging in enjoyable activities becomes increasingly difficult, leading to a potential sense of loneliness. This emotional burden can be just as draining as the physical symptoms, affecting both the person and their loved ones in profound ways. So what should you do if you notice these signs of fatigue in yourself or a loved one? First and foremost, it's essential to prioritize comfort. The person should be encouraged to rest as much as they need, without feeling pressured to push through the fatigue. Rest, combined with a calm and peaceful environment, can help the body cope with this stage. It's also important to provide emotional support, offering a sense of security and assurance that they are not alone in this difficult journey. Finally, seeking medical advice is crucial. While extreme fatigue may be a natural part of aging or illness, it's important to consult a healthcare provider to rule out any treatable conditions, such as anemia, infection, or other underlying health issues. A doctor can help manage symptoms and provide guidance on the best ways to improve comfort, whether through medication, therapy, or other interventions. Taking the time to address this sign early on can improve quality of life during this challenging period and ensure that the person receives the care they need. Sign 2. Loss of appetite and weight loss. A sudden decrease in appetite and significant weight loss can be troubling signs that something is wrong with the body. When someone begins to lose interest in food, it often points to an underlying health issue, especially as we age. While a decreased appetite can sometimes be caused by factors like stress or minor illnesses, persistent or rapid weight loss can indicate a more serious decline in health. For elderly individuals, this may signal the body's diminishing ability to process nutrients, or it could be a side effect of a chronic condition such as cancer, heart disease, or organ failure. Losing weight unintentionally can have several negative consequences for the body. Not only does it lead to weakened muscles and lower energy levels, but it can also compromise the immune system, making it harder for the body to fight infections. The lack of proper nutrition can contribute to a cascade of other health problems, including dehydration, poor wound healing, and fatigue. Emotionally, it can be just as distressing, as the person may feel disconnected from their own body or helpless in trying to regain their strength. This can also take a toll on family members who may feel anxious about the rapid changes and unsure how to best support their loved one. Proper nutrition and hydration are crucial during the later stages of life. The body requires adequate fuel to function optimally, and when it doesn't receive enough nutrients, it can begin to shut down. For older individuals, staying hydrated and maintaining a balanced diet becomes even more important to preserve energy levels, promote mental clarity, and support overall health. Without these essential elements, the body becomes more vulnerable to infections and complications, further accelerating the decline. So, what can you do if you or a loved one is experiencing a loss of appetite and weight loss? The first step is to consult a healthcare provider to determine the root cause. It's important to rule out any serious medical conditions and ensure that the right course of treatment is followed. A doctor may recommend appetite stimulants or adjust medication to help improve appetite. In some cases, a nutritionist or dietitian can offer personalized guidance on how to encourage better eating habits and ensure that the person is receiving adequate calories and nutrients. Along with professional guidance, providing emotional support and encouragement is key. Mealtime can become a social and comforting experience rather than a stressful one. Offering smaller, more frequent meals throughout the day instead of large, overwhelming portions can make eating feel more manageable. Including foods that are both nutrient-dense and easy to eat, like smoothies, soups, or soft proteins, can help ensure that the individual is getting the necessary nutrition. Most importantly, being patient and reassuring can make a big difference in encouraging a loved one to maintain their strength and health during a difficult time. Sign 3. Difficulty breathing and shortness of breath. Difficulty breathing and shortness of breath can be one of the most alarming signs that the body is entering the final stages of life. This is especially true for individuals with advanced illnesses such as heart failure, COPD, chronic obstructive pulmonary disease, or cancer, where the respiratory system is often compromised. As the body begins to shut down, oxygen levels may drop, and the effort to breathe becomes increasingly strenuous. Breathing may become shallow, rapid, or labored, and the person may struggle to catch their breath even when at rest. This is a critical sign that requires attention and can signal that the end of life is approaching. For the individual experiencing difficulty breathing, the sensation of struggling for air can be frightening and incredibly uncomfortable. It can create a feeling of suffocation or panic, adding an emotional layer of distress to the physical discomfort. The lack of adequate oxygen can also cause confusion or disorientation, making it even harder to communicate. On the other hand, for caregivers and loved ones, watching someone suffer with labored breathing can be emotionally devastating. It can leave them feeling helpless and uncertain about how to provide comfort as they witness a loved one endure such a distressing symptom. Breathing difficulties also take a heavy toll on the mental and emotional well-being of both the person and their caregivers. The fear of suffocating can cause anxiety and panic, not only for the individual but also for those around them. Caregivers may feel powerless and deeply concerned, knowing that their loved one is in distress, but unsure of how to ease their discomfort. This can lead to feelings of guilt or frustration, especially if the person is unable to find relief from their breathing difficulties. The stress and emotional burden of this symptom can make it even harder for everyone involved to stay calm and focused on the best course of action. So, what can you do if you or a loved one is experiencing difficulty breathing and shortness of breath? First and foremost, it's essential to create a calm and peaceful environment. Stress and panic can worsen breathing difficulties, so reducing anxiety is crucial. Encourage slow, deep breathing and make sure the individual is positioned in a way that opens up their chest, such as sitting up or propping them up with pillows. Sometimes, simple changes in posture can help ease the strain on the lungs and improve airflow. Monitoring symptoms closely is also vital. Keep track of the frequency and severity of the breathing difficulties, as well as any changes that occur. Seek immediate medical attention if the breathing becomes severe or if the person shows signs of distress, such as bluish lips or fingertips, which can indicate a lack of oxygen. A doctor may prescribe medications to help ease breathing or may recommend oxygen therapy to provide additional support. In some cases, palliative care or hospice care might be appropriate to manage this symptom and ensure the person remains as comfortable as possible during this stage. Sign 4. Uncontrolled pain or discomfort. Uncontrolled pain or discomfort is one of the most distressing signs that someone is nearing the end of life. For individuals suffering from terminal illnesses, pain often becomes more intense and harder to manage as the disease progresses, whether due to cancer, organ failure, or other advanced conditions. Unmanaged pain signals that the body is in a state of decline and that medical intervention is necessary. Pain can range from sharp, stabbing sensations to dull, constant aches, and it can affect any part of the body. As the body weakens, the intensity of pain often increases, and it becomes more challenging to find relief. The emotional and physical toll of uncontrolled pain is significant for the person experiencing it. Constant discomfort can lead to feelings of despair, frustration, and hopelessness. They may feel as though they have no control over their body, and this loss of autonomy can take a toll on their mental health. Additionally, the pain can cause sleepless nights, anxiety, and even depression, further affecting their overall well-being. For caregivers, watching a loved one suffer without relief is emotionally devastating. The helplessness felt in these moments can be overwhelming, as they struggle to provide comfort but feel powerless to ease the pain. Pain, especially when left unmanaged, can also reduce the quality of life significantly. It can affect an individual's ability to eat, sleep, or engage in activities they once enjoyed. This constant state of discomfort can lead to a withdrawal from social interactions and a decrease in overall mental and emotional resilience. As the body becomes weaker, the ability to cope with pain diminishes, making it crucial to address pain management early on. Without proper care, the pain can take over every aspect of life, making the final stages of life even more difficult to endure. When dealing with unmanaged pain, ensuring that pain management is prioritized is key. The first step is to consult with healthcare providers to determine the best course of action. Pain relief medications, such as opioids or other painkillers, may be prescribed, but it's essential to have a tailored approach that meets the individual's specific needs. A healthcare provider may adjust medications, introduce alternative therapies, or recommend holistic treatments like acupuncture, physical therapy, or relaxation techniques to help alleviate the discomfort. Regular pain assessments should be conducted to ensure the pain is kept under control as the illness progresses. In addition to conventional pain management, exploring palliative care or hospice care options is highly recommended. These services focus on improving the quality of life for individuals with terminal illnesses by providing comprehensive care that addresses both physical pain and emotional suffering. Palliative care teams are skilled in managing pain and discomfort in a way that promotes comfort and dignity. They can offer support not only for the person experiencing pain, but also for their family members, providing counseling, guidance, and respite care. Making the decision to pursue palliative care can offer peace of mind and ensure that both the person and their loved ones feel supported during the final stages of life. Sign 5. Mental and cognitive decline. Mental and cognitive decline is often one of the most difficult signs to witness as a person nears the end of life. Confusion, disorientation, and a significant loss of cognitive function can become more pronounced as the body weakens and illness progresses. This may manifest as difficulty recognizing familiar faces or places, losing track of time, or becoming easily agitated or confused over simple things. As brain function deteriorates, the individual may struggle to remember names, events, or even basic daily tasks, leading to a significant shift in their behavior and personality. This cognitive decline often marks a point in which the body's physical and mental health are both in advanced stages of deterioration. The emotional impact of cognitive decline is profound, both for the individual experiencing it and for their loved ones. For the person affected, confusion can be terrifying. They may feel as though they are losing control of their own mind, creating feelings of fear and frustration. They may struggle with feelings of embarrassment or helplessness as they forget things or cannot make sense of their surroundings. For caregivers and family members, it can be heartbreaking to watch someone they once knew as sharp and articulate slowly lose touch with reality. Conversations become challenging, and the emotional connection that was once so strong can feel distant or strained. Cognitive decline also complicates day-to-day interactions. The inability to communicate clearly can lead to misunderstandings, and previously simple tasks may become insurmountable challenges. As memory slips, individuals may forget where they are, what day it is, or even the people around them. This can lead to a sense of isolation, both for the individual and their family. Caregivers may feel overwhelmed as they try to provide both physical care and emotional support while grappling with the changes in their loved one's behavior. For the person experiencing cognitive decline, it can feel as if they are trapped in a world that no longer makes sense. What can you do if you notice signs of cognitive decline in yourself or a loved one? The most important thing is to offer reassurance and maintain a calm and supportive environment. Reassure them that it's okay to forget or be confused, and avoid making them feel guilty or frustrated about their memory loss. Gently redirect their attention if they become agitated, and provide comfort in the form of familiar routines and faces. Engage in simple, positive conversations to help them stay connected to their surroundings, but avoid overwhelming them with too much information at once. It's also crucial to consult a doctor if cognitive decline becomes apparent. A healthcare provider can evaluate the individual's mental function and determine if the decline is related to an underlying medical condition, such as dementia, a stroke, or medication side effects. Depending on the diagnosis, there may be treatments or therapies available to help slow the progression of cognitive decline or manage symptoms. Additionally, healthcare providers may recommend specialized care options, such as memory care or hospice services, that focus on providing a safe, nurturing environment for individuals experiencing severe cognitive decline. This professional support can offer peace of mind for families, knowing that their loved one's cognitive and emotional needs are being met with expertise and compassion. Sign 6. Skin changes and cold extremities. One of the most telling physical signs that the body is nearing the end of life is noticeable changes in the skin. As the body begins to shut down, circulation slows, and the skin may take on a pale, mottled, or bluish appearance. This is due to reduced blood flow, particularly to the extremities, such as the hands, feet, and legs. The skin may feel cool or cold to the touch, even when the surrounding environment is warm. This change in skin color and temperature is a natural part of the dying process, as the body redirects its energy to vital organs like the heart and brain, and the extremities receive less oxygenated blood. For both the individual experiencing these changes and their loved ones, it can be an unsettling and emotional sign. As the skin becomes pale or develops a blotchy purple tint, it can be difficult not to worry about the underlying cause. Cold extremities, in particular, may create feelings of concern and confusion, as this is a very visible change in the person's appearance. However, it's important to remember that these skin changes are a normal part of the dying process and indicate that the body is starting to enter its final stages. The body is conserving energy and preparing for a peaceful transition. These skin changes can also signal a significant emotional shift for the person going through this process. The cool skin may be accompanied by feelings of heaviness or discomfort, making it more difficult to relax or get comfortable. On the other hand, family members and caregivers may find it distressing to witness as the outward signs of decline become more apparent. These changes can be particularly hard to accept, as they are a stark visual reminder that the end of life is near. But understanding that these skin changes are part of the body's natural process of winding down can help caregivers and family members find peace in the moment. So, what can you do if you notice skin changes and cold extremities in a loved one? First and foremost, it's important to keep the person warm and comfortable. Gently cover them with blankets or use warm compresses to provide warmth, particularly to their hands, feet, and other cold areas. Be sure not to overheat them, as comfort is key. Too much heat can cause additional discomfort. Make sure their room is warm and draft-free, as exposure to cold air can exacerbate feelings of chilliness. Additionally, check that they are lying in a position that allows for proper circulation to the extremities. It is also essential to seek professional care when these signs appear. A doctor or palliative care team can provide guidance on the best ways to manage these changes and ensure comfort. They can help with strategies to prevent discomfort and monitor the person's condition to ensure they are receiving the appropriate care during their final moments. In some cases, hospice care professionals can provide even more specialized support, helping to create a peaceful environment and ensure the person's transition is as gentle and dignified as possible. By focusing on comfort and warmth and enlisting the help of healthcare providers, you can ensure that your loved one is surrounded by care and compassion during their final stages. Sign 7. Decreased consciousness and unresponsiveness. As the body nears the end of life, one of the most profound and difficult signs to witness is a gradual decrease in consciousness, or periods of unresponsiveness. This is often a final stage in the dying process, where the person may spend more time in and out of sleep and eventually may not respond to stimuli in the way they once did. They might appear to be in a deep sleep, unable to awaken, or they may have trouble responding to voices, touch, or familiar faces. While this can be alarming for loved ones, it is often a natural part of the body's process of letting go, as the brain and body begin to shut down in preparation for death. During this time, family members may notice that their loved one's responses become less frequent or absent altogether. There may be long periods of silence where the person no longer reacts to questions or conversation. They may not be able to engage in simple interactions, such as squeezing a hand or responding to a familiar voice. For those who are close to the individual, this can be heartbreaking, as it may feel as if the connection they once had is slipping away. However, it's important to understand that while the person may not be responsive in the traditional sense, they may still be aware of their surroundings on some level. Hearing is often one of the last senses to go, so it's crucial to remain gentle and communicative. This decreased level of consciousness can also lead to confusion and disorientation. The person may not recognize their surroundings, may not remember the names of loved ones, or may not understand where they are. These changes can be distressing for both the individual and their caregivers as they struggle to understand what their loved one is experiencing. However, this stage is typically part of the body's natural decline, and it can be comforting to know that it's a sign that the body is preparing for a peaceful transition rather than something to fear. When dealing with decreased consciousness and unresponsiveness, the most important thing you can do is focus on providing comfort. Create a calm, peaceful environment by dimming the lights, playing soft music, or offering comforting scents. Hold their hand or gently stroke their skin to provide a sense of connection, even if they cannot respond. It's also helpful to speak to them softly and reassure them that they are not alone. Even if they cannot respond, your voice may still provide comfort and reassurance in their final moments. Lastly, it's crucial to keep communication lines open with healthcare providers during this time. Medical professionals can offer valuable insights into the stages of decline and provide guidance on how to manage comfort measures. They can advise on the best practices for pain management, hydration, and emotional support. If the person is under hospice care, the team will be there to help manage their symptoms and ensure that they are as comfortable as possible during this final stage. By focusing on comfort, maintaining a sense of presence, and collaborating with healthcare professionals, you can ensure that your loved one's final moments are filled with care and peace. Conclusion. As we've seen, the signs that indicate the end of life can be difficult but important to recognize. Being aware of these signals allows us to provide comfort and ensure that our loved ones are supported during their final stages. Remember, it's essential to stay present, offer reassurance, and seek professional care to ensure a peaceful transition. Thank you so much for watching. If this video helped you or you found it valuable, please comment with a 9 if you feel prepared to recognize these signs, or a 0 if you need more information. Don't forget to like, subscribe, and share for more helpful insights. Take care, and goodbye for now.